Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth. My low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. In today's video, I wanted to share with you yet another incredible before and after hair loss reversal regarding a guy that I found on Trestless. This is another great example that even, despite suffering from hair loss or moderate hair loss for years and years and not really incorporating any hair loss treatments to do something about your hair loss, it's very possible to reverse androgenetic alopecia without the intervention of the traditional FUE hair transplant. A hair transplant isn't technically going to reverse hair loss, but rather it's just going to redistribute existing hairs into bald or balding areas. And a lot of the times, even with hair loss medications, it's not going to be enough to bring back the density. So people typically opt for a hair transplant. While not everyone will respond favorably to hair loss medication, there are a few who have seen some exceptional results solely by combining various medications to fight hair loss. And results like these are very inspirational because, it shows that it works extremely well in certain individuals and also highlights the importance of really just incorporating various hair loss treatments that target hair loss through various mechanisms of action to get the best results possible. So the original poster on Trestless goes by username Manly Coffee, and he posted on Trestless a few days ago to share his amazing results. 25 months, dutasteride, RU588 for 1, Minoxidil, microneedling, Nizoral shampoo, T-gel, and fixing vitamin D levels. The photo here was taken back in July 2019 when the guy was obviously not on any hair loss medication. We can see visible diffuse thinning all throughout his scalp. But based on this photo, I would say the guy still has some pretty good density, at least towards the donor zone. And he also has beard hair, which he could use for a hair transplant if he wanted to later down the road. Now, one of the worst things about people suffering from diffuse thinning is that you're literally just kind of like thinning all throughout the scalp. And it can also be very deceptive and lead to the whole, I'm balding, I'm not balding, I'm balding, that kind of thought cycle. It's difficult to notice sometimes until it's already a bit far gone. It can also manifest like telogen effluvium. I'd rather honestly just start balding on the hairline than with diffuse thinning all throughout, because with the hairline, you can easily get it fixed with a hair transplant with a couple thousand grafts on average. But when you're like diffuse thinning, you're battling a whole different beast. You're not only thinning on the hairline, you're also thinning on the mid-scalp, the crown area, which can obviously eat up a lot of grafts. But anyway, this guy was on 500 mcg dutasteride, which translates to 0.5 milligrams dutasteride. He's been using Minoxidil 5% twice a day, weekly Nizoral shampoo containing 2% ketoconazole, microneedling on a weekly basis using a Dr Pen A1 set at 1.5 millimeters. He's also using RU588 for 1 milliliter, 5% in PG and ethanol as a carrier. And then he's also using something called T-gel shampoo every shower, except on the day that he uses Nizoral shampoo. And after the set treatment for the past 25 months, this is the result that he got. Basically a complete reversal of hair loss. And if I saw this guy out on the street, I wouldn't even notice that he was suffering from hair loss. There's absolutely no signs of thinning. His hair appears to look extremely dense. His hairline is solid. His temporal points also seems to have improved in density as well. So this guy basically hit the jackpot in terms of hair regrowth solely with medication that he's been on. He could have initially gotten a hair transplant even before starting his hair loss treatment regimen, but he decided to give medication a try, and as a result was able to not only regrow back his hair, or a majority of his hair, he was also able to save thousands and thousands of dollars that would have gone towards a hair transplant. And, just kind of like looking back, I sometimes regret not trying medication, first before jumping straight into a hair transplant. My case of hair loss wasn't even that severe to begin with, and a couple hair transplants obviously fixed the receding hairline. But, I always wonder, would it have been possible that finasteride or, microneedling and Minoxidil could have brought back my receding hairline? So I always recommend people to get into the habit of starting a hair loss treatment regimen first, at least for a few months to see how well you respond, because just like this example that I just shared with you guys, you never really know until you give it a try. And for those who do respond very favorably to treatment, it may even possibly reverse your hair loss and bring back a majority of your hairs that you have lost over the years. Now, everyone's hair loss treatment regimen is going to vary to some degree. The common treatment involves, finasteride 1 milligram, minoxidil 5% twice a day, maybe ketoconazole shampoo, and microneedling. This is typically what most people stick with, and for the most part, it will help slow down further progression of hair loss in the majority of users. But if you guys did want to kind of step it up a notch, like it was in this guy's case, he's been taking dutasteride over finasteride. And as you guys know, dutasteride is a much more potent 5-alpha reductase inhibitor that blocks the conversion of testosterone to DHT almost to near pre-puberty levels. It's going to wipe out about 9% plus of systemic DHT. And there are multiple studies that show the efficacy dutasteride has in those who actually do not respond to finasteride. Minoxidil is also recommended, especially if you guys are microneedling, because studies do show a better improvement in terms of hair density and hair growth when the two are used synergistically. So you might as well just combine both treatments together while you're at it. It's not a big deal. And lastly, this guy is using RU-584-1. It's been around for some time now, but it never kind of went through the whole FDA process for androgenetic alopecia. But there are a lot of people who are using it as a non-steroidal experimental anti-androgen. And basically, it works by preventing DHT from attaching to the hair follicles. This is different from a 5-alpha reductase inhibitor like finasteride or dutasteride, which reduces DHT, but for RU-584-1, it prevents DHT from activating the androgen receptor. So, obviously it doesn't, or it's not supposed to change the hormonal profile, which theoretically means that it shouldn't cause any side effects. But I personally don't use it because it's not FDA approved. It hasn't gone through the rigorous testing like finasteride has and even dutasteride. And there's still a lot of unknown factors from long-term use. Some users do complain about potential side effects, but in a perfect world, the combination of a 5-AR inhibitor and an anti-androgen would be the best course of action to really stop genetic hair loss in its tracks. Luckily, we do have the company, as you guys might know, Cassiopeia in the works that is developing their first anti-androgen called clasicoterone, which currently is in their, I believe, phase 2 clinical trials. So hopefully things go as planned, and once it is readily available, people can add it to their hair loss treatment stack. Lastly, this guy has been using something called T-gel shampoo. I've never really heard of this, so I did some research, and apparently it does help with dandruff and psoriasis. But he probably could just get by using Nizoral shampoo a few times a week, as the active ingredient ketoconazole in Nizoral shampoo does exactly the same thing. But the main thing here is that he is on dutasteride, RU, minoxidil, microneedling, which are sort of kind of like the main treatments that he's been using to promote hair growth and basically halt, further hair loss. It's really difficult sometimes to kind of see what treatments are working and which ones aren't, especially if you guys are kind of stacking and combining different treatments synergistically. He might have, solely just seen all of that regrowth in his after photo from just, for example, maybe minoxidil and microneedling. But at the same time, you have to realize that you have to really target the root cause of hair loss in its first place. Minoxidil will help increase density and hair diameter size, but it's not going to do anything to target the androgens. So this is why you have to incorporate a 5-alpha reductase inhibitor to lower your DHT levels. And to bump it up a notch, like I said, he's applying topical RU to block the androgen receptors. So I think, this guy is set. He's pretty much covered all of his bases, and seeing that he was such a great responder in stopping hair loss, but also the fact that he was able to regrow the majority of his hair back is very promising. A lot of these treatments aren't going to show immediate results, and oftentimes it is going to require a lifetime commitment, and you really have to put in the time and the effort and really be consistent with it. This guy saw incredible results at 25 months, and that also shows you that you have to be patient sometimes, and it may take as long as 10, 12, maybe 24 months to start seeing visible results. The bottom line is that you really need to come up with a long-term plan, and the sooner that you guys act, the the more hairs that you'll be able to salvage. So get on a 5-alpha reductase inhibitor, whether that's oral finasteride or dutasteride. You guys can also look into topical dutasteride, topical finasteride. Get on minoxidil with weekly microneedling, and for those who are willing to try experimental RU as an anti-androgen, throw it into your hair loss treatment regimen, see where it takes you. Who knows, you guys might experience some crazy hair growth like this guy did, and you guys will be glad that you started sooner than later. Anyway, that's all I wanted to share in this video. Once again, incredible results for this guy, and I am super happy for him, and hopefully he will be able to maintain his hair in the long run. Thanks for watching, guys. If you guys have any questions, make sure to send me an email. You guys can reach me through the comments. Also, I hold hair consultations if you guys are looking for a good hair transplant doctor, or simply just kind of want some recommendations as far as what treatments to start. You guys can visit my website at HAIRLICIOUSLY.com and sign up for a consultation with me. That's it for this video, guys. Thanks for watching, and I will talk to you guys next time. Take care.